Oh, it's working. Okay. I'm gonna give you guys some time to get in. Alive. Not alive, but a message. Because ID Live was playing with me. And acting like he didn't want to connect. I was like, ooh, you're trying to embarrass me. I'm eating some study gummies because we about to get it in. Study gummies, get you some. Alright, so I'm eating mine. How y'all doing this Thursday? Happy Thursday. Happy Thursday. Hey, Valdosta. Hey, boo, hey. Hello to all of you. How are you guys doing today? Go eat yours. Okay. So you guys already know what y'all came here to do. It is time for NCLEX Jeopardy. And I know we didn't have our live Jeopardy last week because I was sick. But we still had a new set of questions in the app. So make sure you guys download the Nurse Sam app to supplement our lives and to supplement your studying, because the same questions that we're doing on live, you get that plus more. We have 25 new questions to review on the Nurse Sam app on the mobile version of NCLEX Jeopardy every week. So even though we do the our live questions at 7, after we finish doing our questions, and I then update the app to reflect the questions that we just did, because we never get through all 25 questions. We get through like maybe 10 maybe 10 through our time together, and then I let you guys study, do some solo studying. If you want to do it with a group or by yourself, it's totally up to you. That's the magic of the app. You can download it and study it, and study the material and the content in it whenever, wherever, with whomever, at any time, any place. It's the magic of digital products, and just being able to have like an app and a mobile app and everything like that. So you can play, you can bust that out and play if you in your Uber, wherever. It's great to just have some really practice, and practice definitely makes perfect, or as perfect as possible when you're studying for the NCLEX. I always say make sure you practice daily, practice your questions daily. And with the app and the mobile version of the NCLEX, we're giving you 25 questions weekly, and then we do our weekly NCLEX review on live that you guys are here for now. So with that being said, let's go ahead and get into why you guys are here, okay? All right, so you guys, we are here for our free NCLEX review, and because this is Nurse Sam, and you guys know that I do not do boring studying, period. I do believe that you retain more when you're entertained. So everything that I do as far as nursing school, as far as like resource-wise, I try to make it fun, entertaining, creative, something that delivers the same content that you find in your textbooks and wherever else, but just deliver it in a different way that's a little bit more interactive, more entertaining, so that it can stick in your memory more. You're able to recall it more, you're able to retain it more. Okay, so we are doing our review. We're doing questions, we're doing practice questions, and we're doing the rationale afterwards. Great way to study, by the way. We're just doing it in a Jeopardy style, so it's going to be super fun. If this is your first time, welcome. If it's not, hey boo hey, welcome back. You guys already know what we're doing. Okay, so how we're going to play is I'm going to read the questions. I'm going to read the answers. Because this is Jeopardy style, you guys are going to answer what is and then whatever the answer choice is. Now, how NCLEX Jeopardy plays, we only do just multiple choice questions for now. I'm going to find a way to incorporate like select all that apply and everything like that, or just more to come on that later. But for now, all we're doing is multiple choice, so there's only going to be one answer. So whenever we're playing, whenever you have to answer the question, you have to say what is and then whatever the answer is. So it's going to be 1, 2, 3, or 4. So you can say what is 2, whatever the case may be. Now, I always say this disclaimer at the front. Somebody always asks me later on, whatever the case may be, let me go ahead and tell you guys now, because we are playing on Instagram Live. The internet's going to be different, so some may lag, some may not. Yes. So some screens may lag, some screens may not lag. So some of the comments that you put up may not show up on my screen when it shows up on your screen. I can't see your screen, unfortunately. I can only see mine. So when I am going and I'm picking my my winners for the question, I'm only going off of what I see on my screen, okay? Before I call out the answer, I'm going back and I'm making sure that I'm picking the first person that answers the question correctly. All right, I'm making sure that I don't miss anybody. But unfortunately, if something looks different on your screen or my screen, I can only go by what's on my screen, and so the person that I see is just the person that wins on my screen. Okay, so even though we are playing for prizes, and we're always playing for prizes and incentives, like I said, it makes it a little bit more fun. It makes you a little bit more motivated to win. We are playing for 2 winners tonight. The 2 winners are going to win free Ultimate Nursing School bundles. If you have not won, basically it's free NCLEX prep that you're going to be winning, okay? So your first prize option is going to be the Ultimate Nursing School bundle. All right, that is a $297 valued bundle. It's 400 pages. It's pretty bomb, but it's worth $97. It's priced at $97, but you win it for free if you get one top 2 highest points, okay? If you already have the bundle, we move on to NCLEX Arcade, okay? Do you have NCLEX Arcade? The workbook, if not, that's what you're getting, boo, okay? So we are definitely playing to make sure that you get whatever you need to pass the NCLEX. That is the whole point of us doing NCLEX Jeopardy. NCLEX Jeopardy Thursdays is to make sure that you guys have everything you need to pass the NCLEX and become the great, amazing nurses that I know you guys can be, okay? That's why I quit my job, to make this my job, to make sure you guys can pass, okay? All right, so like I said, I'm going to read the question. I'm going to read the answer choices. You guys are going to answer what is in the comments, okay? I'm going to pick whoever answers first and correct on my screen. You guys are going to be on the scoreboard. We're playing for the top 2 highest point answers. Where's my scoreboard? Hold on. Using the handy dandy student nurse notebook. All right, let's go ahead and make our new scoreboard. Okay. Using our wonderful pen that comes with our Nurse Life Planner. Glitter pen. All right, so this is our scoreboard for today. Now, you guys know with Jeopardy, there's going to be 5 categories. Our categories for today and our answer categories, or question categories for today are, wait for it, 2 seconds. Okay, yes. All right, so our topics for today, we have pharmacology, pediatrics, mental health, fundamentals, and adult health, fast med surge. That's basically what that is. Okay, so we are covering those basic topics. We have 5 questions per topic, each ranging in answers, each ranging in points from 100 to 500 points. Okay, so that's how we're going to play. The higher the points, obviously, the higher chance you have for winning. Okay? So if you guys have any questions, go ahead and drop them now. If you don't have any questions, I'm going to go ahead and rev it up so we can go ahead and play. If you guys are ready to go ahead and start our first question, go ahead and give me a thumbs up and give me the category you guys want to start with. Okay? Give me a thumbs up in the category you guys want to start with if you're ready to play. If not, ask me a question that you need in order to get started. All right. Let's go ahead and reset that. And, oh wait. Okay, good. All right. What are you guys saying? All right, people are ready. I'm seeing pharmacology, adult health, med surg, fundamentals, foundations, blah, 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 blah. I'm seeing more farm than anything, so let's go ahead and do farm. All right. Pharmacology. Let's do farm for... $300. Sure. Farm for $300. Let's do it. Pharmacology for $300. All right. Make sure you guys are tagging whoever needs a NCLEX review, RN or PN, does not matter. This is general nursing knowledge that you're going to need, whether you are LPN, RN, Pop-Up Girl, Ninja Turtle, whatever, okay? All right, pharmacology for $300. It says, a client is scheduled to have heparin sodium 5,000 units subcutaneously. What is the most appropriate nursing intervention? 1. Inject via an infusion device. 2. Inject ½ inch or 1.25 centimeters from the umbilicus. 3. Massage the injection site after administration. Or 4. Avoid aspirating prior to injecting the medication. All right, I'm going to read it again. A client is scheduled to have heparin sodium 5,000 units subcutaneously. What is the most appropriate nursing intervention? 1. Inject via an infusion device. 2. Inject ½ inch or 1.25 centimeters from the umbilicus. 3. Massage the injection site after administration. Or 4. Avoid aspirating prior to injecting the medication. Let's look and see what our answer is. What our answer is. Hold on. Because I always... Two seconds. Okay. Sorry, I was trying to make it interactive. All right, let's look and see what that answer is. It is, what is 4, avoid aspirating prior to injecting the medication. What is 4, avoid aspirating prior to injecting the medication. Let's look and see who got that answer first on my screen. All right, let's look and see. I saw a lot of different answers. All right, let me look and see who said what is 4 first. Baby Asa DP. Yeah. Baby Asa DP, congratulations, love. You are first on my screen. So therefore you are first and the winner of this particular question. So you are on the scoreboard for 300 points. Congratulations. All right, so it's Baby Asa Asia? Whatever. Asa ADP. I think. Yep. ADP. All right. 300 points for you. Great job. All right, so now a lot of people got what is 4. That's totally fine. That's why we are doing NCLEX Jeopardy, so we can see where we went wrong, so that when we come across it again, we won't make the same mistake again. All right, so great job, baby, for getting that question correct and choosing what is 4. I see you, Ashley. You got what is 4 correct as well. Alana, Smiles, MGB, Claudia, Yaya, Janice 5. It's Liz, Toya. Great job, guys. Great job. All right, so rationale-wise, so we can know why the answer was avoid aspirating prior to injecting the medication. All right, it says aspiration should be avoided before injecting the heparin because it can cause hematoma at the administration site. Heparin sodium administered subcutaneously does not require an infusion device and is injected at least 2 inches or 5 centimeters from the umbilicus or any scar tissue. The needle is withdrawn rapidly and the site is not massaged, although pressure is applied. Okay, so what is 4 is the correct one. Okay, so I'm gonna say it once more. I can only go by what's on my screen. So if I didn't call your name, then you weren't first on my screen. I may have someone else may be first on your screen, but I can't see your screen. So once again, we're only going by what's on my screen. I'm so sorry if you were first before whoever won this round, but you won't be first. That person won't be first on the NCLEX, so that's what really matters. Okay, great. All right, so great job to everyone that got 4. As long as you got the answer correct, that is definitely what we are aiming for. Congrats to Baby again. You were first on my screen. Okay, so congrats to you. We still have plenty of game to play, plenty of opportunity for you guys to play and get first and get up on the scoreboard and win these free gifts. Okay, there's plenty of opportunity to win some free stuff, and a lot of times the people that do win end up donating their bundles, especially if they have it already. Okay, so let's go ahead and go to, somebody said let's do somebody wanted to do fundamentals next, so let's do fundamentals. Okay, let's do 400 points. Fundamentals for 400 points. Thank you. I appreciate that. All right. So, fundamentals for 400 points. Here we go. Yes, everyone gets practice. Everyone gets opportunity to win free stuff. It's a party every time. Listen, Thursdays at 7 p.m. Eastern Standard Time, it's a party. Okay? You get free stuff. You don't get food. I'm sorry. If I can give you virtual stuff, maybe in the metaverse, I give you some virtual chicken tendies and truffle fries. I don't know what the metaverse has for us, but look, it was up to me. Absolutely, I'll have y'all some digital food. But right now, I don't got digital food for you. But if I did, I'll throw pizza down your throat, just like healthcare. These administrators try to throw it down our throats for picking up shifts. Okay, we got pizza and patho. All right, pizza and farm. All right, so fundamentals for 400. A client has just returned to a nursing unit after an above-knee amputation of the right leg. Okay? Above the knee amputation of the right leg. The nurse should place the client in which position? 1, prone. 2, reverse Trendelenburg. 3, supine with the residual limb flat on the bed. Or 4, supine with the residual limb supported with pillows. I'm going to read that one more time. A client has just returned to a nursing unit after an above-knee amputation of the right leg. The nurse should place the client in what position? 1, prone. 2, reverse Trendelenburgs. 3, supine with the residual limb flat on the bed. Or 4, supine with the residual limb supported with pillows. What is the answer? All right, so I'm seeing a mix of 3 and 4s, which I'm glad I'm seeing majority 3s and 4s, because I'll tell you guys why when we're doing this. Y'all, it's a certain study tip, and I live by it on whatever test, T's, NCLEX, whatever the case may be. This is a tried and true study tip, and it applies right here. So let's look and see what our answer is. answer is, what is 4? Supine with the residual limb supported with pillows. All right. Let's see who's the first person to get what is number 4 on my screen. All right, let's look and see. It was baby again. It was baby ASA. Is it baby aspirin ADP? I'm just kidding. It's ASA. All right, baby, congratulations again. All right, so you are already on the scoreboard with 300 points, and you just got another 400 added. So you are on the scoreboard with 700 total points. Awesome job. Great job. A lot of people was choosing what is 3. But let me see the other people that got what is 4. Okay, so baby was the first person on my screen to get what is 4. And then Marche, you also got it. CP 108813 got it. Sarah got it. I already said you, Marche. BLSN got it. Z Love Locks, BM Love, Forever Desiree, Janice 5. Good job. Awesome job. Aspirin. Aw, I love that. Assad. Oh my God, I love that. Okay, baby Assad, you are killing it, love. 700 points for baby Assad. All right, so congrats to everyone that got what is 4. The people that got what is 3, we're gonna go over the rationale right now, okay? All right, so it says the residual limb is usually supported on pillows for the first 24 hours following surgery to promote venous return and decrease edema. After the first 24 hours, the residual limb usually is placed flat on the bed to reduce hip contracture. Edema also is controlled by limb wrapping techniques. In addition, it is important to check primary healthcare provider prescriptions regarding positioning following amputation. Let me see. I didn't see you up there, baby mama. Depends. Like I said, I can only see what's on my screen. So if it's something that's not, if you're submitting it or something, and it's not like going through or whatever. I guess not. I can only see what's on my screen. I don't know how Instagram works. Submitted twice just to make sure. I don't know. All right, so what was I saying? Okay, so a lot of people was, like I was saying, was choosing between 3 and 4. So this is my tip that I was telling you guys before. I'm gonna tilt the camera so you guys can see the screen, so you guys can see the question, so you can know exactly what I mean. All right, so this was the question. Yes, so this is the question. All right, and a lot of people were choosing 3 and 4 already, and it's obviously the answer was 4 because of that's just the answer. But if you did not know what the answer was, and let's say you were between answers, a good tip is if you see out of the 4 answer choices, especially if it's multiple choice, if you see 2 of the answers with the same answer, but like flipped in reverse, like almost opposites of each other, then more than likely one of these answers is going to be the actual correct answer. For example, 3 and 4. All right, 1 says prone, 2 reverse Trendelenburg. Those are different things. 3 and 4 are both supine. 3 is supine with the residual limb flat. 4 is supine with the residual limb supported with pillows. Okay, what are the odds of both of those being a supine? One with one flat, one with one raised. What are the chances of both of those options being there, but none of those being correct? Like, what is the point of making that differentiation? Like, yes, one with the pillow and one without the pillow. You have to think into that, okay? Whenever there's 2 questions, answer choices that are very similar but opposite, more than likely, one of them is going to be the correct answer. It's very similar to someone saying, okay, is the lights going to be, are you going to walk into the room with the, well, what's another way to rephrase that? When the light switches on, the room is dark. When the light switches on, the room is lit. Like, it's, you see what I'm saying? Same answer, but opposite choices. So usually when that happens, one more than not, it's one of the answer choices. So that's why I was like, okay, if you really didn't even know the answer, 3 and 4, just reading that should have hinted you that one of these was going to be the answer. And then, you could have deduced and made whatever educated guess into getting 4. So instead of having a 25% chance of getting the answer right, you now just eliminated that, and now you're 50% chance. Okay? Make sense? Awesome. All right. Cool. All right, so we did a pharmacology, we did the fundamentals. All right. Now let's do a mental health. Okay. And somebody had said, like, type a comment so there's like no confusion between previous answers and answers now. There's usually a bunch of people commenting or somebody joining between the last comment and, me answering this comment. All right, so right now someone's saying med surg next, please. Let's do med surg instead. Let's do med surg for 500. All right, let's do med surg for 500. All right. Right now nobody has answered any. There's no 1, 2, 3, 4. What is whatever on the screen right now? So I'm gonna go ahead and answer. I'm gonna read the question, okay? All right. So adult health med surg for 500. The nurse is preparing to perform pin site care for a client in skeletal traction. On assessment of the pin site, the nurse notes the presence of serous drainage. Which nursing action would be appropriate? 1. Document the findings. 2. Notify the primary healthcare provider. 3. Remove 2 pounds of weight from the traction. 4. Lift the weights and place them on the bed so the primary healthcare provider can assess the client. I'll read that one more time, okay? The nurse is preparing to perform pin site care for a client in traction. On assessment of the pin site, the nurse notes the presence of serous drainage. Which nursing action would be appropriate? 1. Document the findings. 2. Notify the primary healthcare provider. 3. Remove 2 pounds of weight from the traction. 4. Lift the weights, place them on the bed so that the primary healthcare provider can assess the client. Which action or which nursing action would be appropriate? Let's look and see what our answer is. Remember to, this is Jeopardy, so remember to put what is before your numbers, just so we know that we're playing NCLEX Jeopardy, okay? All right, so let's look and see what our answer is and who's the first person to answer correctly on my screen. All right, so the answer is, what is 1, document the findings? The answer is, what is 1, document the findings? Let me go ahead and scroll up to see who is first. CP 108-813. Congratulations, you are on the scoreboard. 108-813. You are on the scoreboard with, that was 500 points. So congratulations. All right, so we have Baby Assad on the scoreboard and in the lead with 700 points. And then we have CP 108, 813 in second place with 500 points. We still have about 30 more minutes, so it could still be anybody's game. Once again, even though we are playing for incentive, we are really playing for practice. And as long as you get the answers correct, you guys are really winning. Okay? All right, so let's go ahead and do another one. Go ahead and let me know what category you want me to do. Great job to everyone that said what is what. Wait, did I read that? What did we just do? What is one? Okay, I didn't read it. My bad. All right. So it's what is one? Document the findings. It says a small amount of serous oozing is expected at the pin insertion site. The nurse would document the findings. It is not necessary to notify the primary healthcare provider. Once again, it's expected findings. The nurse would not add or remove any weight from the client's traction setup because this would disrupt the alignment of the fracture. Yeah, I was like, ooh, do not do number 3 or 4. All right, 3 and 4 was definitely, I knew were definitely like wrong in my mind because I knew that was disrupting the alignment of the fracture. So I saw a lot of like 1s and 2s. And usually if it's document the findings, it's an expected finding. And usually if notify the primary healthcare provider, it's something that's not expected, something that needs to be addressed. So for example, this question is asking, well, it's saying that the nurse noted the presence of serous drainage. You guys know that serous drainage is expected at a pin site, especially following surgery. Let's say the drainage was, what is it called? Purulent. Let's say there was purulent drainage noted at the infection site. Then you would notify the primary healthcare provider because that would be indications of an infection building, an infection present. So that would not be an expected finding. So whenever you're documenting findings, whenever you note findings and then the answer is to just document them, it's because it's expected and normal. Whenever you note findings and you have to immediately notify a provider, it's because it's not expected, not normal, not okay. Do not pass go, do not collect $200, go and call somebody, all right? So let's see what you guys are saying. Mental health, maternity, so it's mental health. All right, let's do mental health, guys. Mental health 200. Mental health for 200. All right. A client is admitted to the mental health unit after an attempted suicide by hanging. The nurse can best ensure client safety by which action? 1. Requesting that a peer remain with the client at all times. 2. Removing the client's clothing and placing the client in a hospital gown. 3. Assigning the client Assigning to the client a staff member who will remain with the client at all times. And then 4 is admitting the client to a seclusion room where all potentially dangerous articles are removed. How y'all answering before I finish the question? Now, I didn't even finish reading all the answer choices and y'all are saying 1. I did not even finish reading all the answer choices and y'all are saying 1. And I know why y'all said 1. Now I'm going to read y'all. I know why y'all said 1 too. Because, just because, I'm going to read it too. 1 says requesting that a peer remain with the client at all times. I read that and y'all was like, has to be it. First of all, okay, the answer is not 1, so let this be a lesson to you guys. Let this be a lesson to you guys. Do not answer an NCLEX question Do not answer NCLEX nursing. Don't answer a question, period, without hearing all the answer choices. This is a surefire way to most likely get it wrong. Okay, we're not doing this. All right, we're not doing this. We come here. We are passing. All right, we're not making small mistakes like not listening to the whole question, and that's why we fail. All right, it's not going to be our story. It's just not. Okay, not when we're being coached by Nurse Sam. Absolutely not. Okay, we're going to listen to the whole question, the whole answer choices, then we're going to answer. Okay, we're going to nip that habit in the bud because we are passing NCLEX. All right, we're not going to let this little small thing like this lead us to a wrong question, because all y'all that chose number 1 got it wrong. All right, so the answer is actually number 3. All right, now like I said, y'all chose number 1 because it said at all times. Now number 3 also had all times, but I didn't even get number 3 out before y'all was saying number 1. All right, so number 3 says assigning to the client a staff member who will remain with the client at all times. All right, that was number 3. Number 1 says request that a peer remain with the client at all times. All right, you see the difference? Can anybody tell me the difference between 1 and 3? The difference between why it's number 3 and not 1. We have somebody with them at all times. So what's the difference between a peer being with the client at all times and a staff member being at a client at all times? I just told you. Yeah, peer, staff member. All right, you definitely want your staff member to be with the attempted suicide patient, not your homegirl from Instagram. But like, hey, future ER nurse, real quick. My nurse is busy, really. My staff nurse is busy, but can you hang with that patient real quick? I just need somebody, client, staff member not here, but you my peer. I follow you, you follow me. Yeah, hey boo, hey, can you stay with them real quick? That's not gonna work. That's not gonna work. It has to be a staff member with that client at all times, especially because that client is not stable. They had an attempted suicide by hanging, so that's not a stable client. So you're gonna need definitely a staff member. So as far as rationale, and read you what that rationale actually says. It says hanging is a serious suicide attempt. Who thought it wasn't? But okay. The plan of care must reflect action that ensures the client's safety. Constant observation status, or one-to-ones, with a staff member is the best choice. Placing the client in a hospital gown and requesting that a peer remain with the client would not ensure a safe environment. Seclusion should not be the initial intervention, and the least restrictive measure should be used. Okay, so that's why it wasn't the seclusion, because that wouldn't be the initial intervention. Sometimes seclusion isn't the best intervention, especially for someone that just had a suicide attempt. Let me look and see what y'all saying. Awesome job. All right, so I'm glad y'all see the difference between 1 and 3. Perfect. Oh, I was looking for my mouse. It's my laptop. All right, great job, guys. Now let's do. We don't have maternity on this one. We have peds though. We can do peds. Let's do peds for 300. All right, peds for 300. A child is scheduled to receive inactivated poliovirus vaccine, or IPV, and the nurse who is preparing to administer the vaccine reviews the child's records. The nurse questions the administration of IPV, if which is documented in the child's record. 1. Recent recovery from a cold. 2. A history of frequent respiratory infections. 3. A history of anaphylactic reaction to neomycin. Or 4. A local reaction at the site of injection of a previous IPV. I did not say who got the last question. Am I insane? 1 second. Oh, it's pink Rhea. My bad. I was so busy reading y'all for saying what is one. It was pink Rhea. Let me go back out and make sure. Yeah, because all y'all was saying what is one. Yep, it was pink Rhea. My bad. In my mind, I was like, pink Rhea's the only person I got it. All right, my bad for not giving you a shout out, pink Rhea. My bad. So pink Rhea got that last one. Pink Rhea 2, congratulations. What was that? That was 200 points. So you are on the scoreboard with 200 points, pink Rhea. So my bad. I'm so sorry. All right. But everybody else that got 3, awesome job. Wait. Okay. Yep. Someone's asking for neuro questions. I'll look and see if there's any neuro underneath med-surg, but neuro isn't an actual category in this one. But if y'all want to vote on categories for next week, we can do that if y'all want. All right, I'm gonna read this next question again. Yes, my lashes are moving because my lashes are definitely a filter. All right, I'm gonna read this again because I didn't read who's the last person who got the last question. All right, a child is scheduled to receive inactivated poliovirus vaccine, or IPV, and the nurse who is preparing to administer the vaccine reviews the child's records. The nurse questions the administration of IPV if which is documented in the child's record. 1, recent recovery from a cold. 2, a history of frequent respiratory infections. 3, a history of anaphylactic reaction to neomycin. Or 4, a local reaction at the site of injection of a previous IPV. And our answer is what is 3. Great job. All right, first person to get what is 3. Wait for it. Daddy's girl for life. I know that's right. I know that's right. I'm a daddy's girl too. All right, so great job, daddy's girl for life. You are the first person to get what is 3. And that gives you 300 points on the scoreboard. We still have like 10 minutes. It can still be anybody's game. Let me go ahead and read you guys our scores so far. We have Baby Assad in the first place with 700 points. Then we have CP 108813 with 500 points. And then we have Daddy's Girl for Life with 300 points. And then Pink Rhea with 200. All right, so we're going to play with the big bucks, the big points from for the rest of the game, okay? We're going to get these points. Great job to everybody that got what is 3 on this last one. So what is 3 says a history of anaphylactic reaction to neomycin. Let me read. All right. It says IPV contains neomycin. So a history of anaphylactic reaction to neomycin would be definitely a cause for concern. And it's actually a contraindication to IPV administration. So the presence of a minor illness such as the common cold, that's not a contraindication. So 1, which was recent recovery from a cold, that wouldn't cause the nurse to question the IPV administration. So 1 was out. It says, in addition, a history of frequent respiratory infections is also not a contradiction to receiving a vaccine. So 2 is out. A local reaction to an immunization is not a contraindication to receiving a vaccine. Usually local reactions are like side effects to almost any vaccine. Almost, it's not a contraindication, it's just a side effect. Honestly, it's just a side effect that you can expect. It may or may not happen, but if it is just a side effect of the vaccine, just a local react, like swelling, pain at the injection site, once again, not a contraindication, more likely a side effect, and just a nuisance, but not a contraindication. The question says the nurse questions the administration of IPV. So obviously the nurse would have to see something in the child's record that would be a contraindication, or I would say a contraindication of giving IPV. And of 1, 2, 3, and 4, 3, the anaphylactic reaction to neomycin, because neomycin is a component of the IPV vaccine. So, with you guys know, with any drug card, they'll be like, what's the contraindication? Having an anaphylactic reaction or being allergic to components of the drug or the drug itself, So that's definitely the case in this particular question. Neomycin is a component of IPV. So if you are allergic to neomycin, you cannot have IPV. It's kind of like with the whole, if you ever had an allergic reaction to eggs and you can't have the flu shot type thing. So pretty much the same thing. All right, so awesome job. All right, I said who got that one. Great. All right, let's do fundamentals next. And this is fundamentals for No, I lied. Let's do med surge for 400. I want y'all to do this one. Med surge for 400 points. This is a good one. All right, y'all ready? Okay. The nurse manager is providing an educational session to nursing staff members about the phases of viral hepatitis. The nurse manager tells the staff that which clinical manifestations are primary characteristics of the pre-ecteric phase. 1, pruritus. 2, right upper quadrant pain. 3, fatigue, anorexia, and nausea. Or 4, jaundice, dark-colored urine, and clay-colored stools. What is our answer? All right, I'm going to read that again. The nurse manager is providing an educational session to nursing staff members about the phases of viral hepatitis. The nurse manager tells the staff that which clinical manifestations are primary characteristics of the pre-ecteric phase of viral hepatitis. All right, is it 1, pruritus, 2, right upper quadrant pain, 3, fatigue, anorexia, and nausea, or 4, jaundice, dark-colored urine, and clay-colored stools? What is our answer? All right, our answer is, what is 3, fatigue, anorexia, and nausea? What is 3? Let's see who's the first person to get what is 3. On my screen. Daddy's Girl for Life. All right, great job, Daddy's Girl for Life. So you just got another 400 points added. You already had 300 points, so now you are on the scoreboard with 700 points and actually tied for first place with Baby Assad. Both of you guys have 700 points and you guys are tied. All right, so let me go ahead and read the rationale. Great job to everybody got 3. All right, this is a good one because you were supposed to know, you got to know the phases of viral hepatitis. All right, it says, in the pre-icteric phase, the client has non-specific complaints of fatigue, anorexia, nausea, cough, joint pain. And the basically all the other options are actual manifestations that occur in the actual icteric phase. In the post-icteric phase, the jaundice decreases, the color of urine and stool returns to normal, and the client's appetite actually improves. All right, so pruritus, the right upper quadrant pain, and that jaundice, dark-colored urine, and clay-colored stools, those are all manifestations of the icteric phase. Okay, fatigue, anorexia, nausea, that is in the pre-icteric phase. And if you kind of let the word help you, okay, the prefixes, suffixes, that pre-icteric phase, pre means before. So if I'm looking at the options here, pruritus, right upper quadrant pain, fatigue, anorexia, nausea, jaundice, dark colored urine, and clay colored stools. If I'm looking at that and I'm looking for characteristics that may describe a pre-icteric phase or something that may occur before a certain phase, I'm going to go for the less, what do I want to call them? The less, or the non-specific. I'll just call them the non-specific complaints and the less severe complaints. So just like the non-specific fatigue and the malaise and just the nausea, those beginning feelings of like, something, I don't feel well, something's happened, that pre, before, that pre is really that word that's going to, that helped me. If I didn't know if I didn't exactly know what the pre-icteric phase was, I can just kind of let the word help me, which is what I strongly recommend anyone does. It's just a strategy. This is another study strategy for when, because you're not going to remember everything when you draw a blank on specific words or phrases or whatever the case may be. Just kind of dissect the word and take it apart and kind of see if you can deduce the correct answer. All right. So like I said, the non-specific complaints like the fatigue and the anorexia and the nausea, vomiting, diarrhea, like you guys know from the from farm. Those are the characteristics from the pre-icteric phase. Okay. Let me see if you guys have any questions. Nope. All right, let's go ahead and do one more. Let's do farm for 500. Let's do one or two more. Okay, farm for 500. It says Gemfibrozil is prescribed for a client. Which laboratory finding should alert the nurse to the need to withhold the medication and contact the primary healthcare provider? 1, elevated glucose. 2, elevated triglycerides. 3, elevated liver function tests. Or 4, elevated blood urea nitrogen, or BUN. Gemfibrozil. That's it. Gemfibrozil, prescribed for a client. Which laboratory findings should alert the nurse to the need to withhold the medication to contact the primary healthcare provider? All right. So remember just how we broke it down before. The question's asking us, what lab finding are we going to find that's going to let us know, hey, do not give this medication, and you actually probably need to call a doctor. All right, so we're going to be looking for something that's not expected. We're going to be looking for something that's pretty bad. Especially for a client receiving Gemfibrozil. So you make sure you know what kind of medication that is. So let's look and see what the correct answer is. All right. The answer is what is 3. The answer is what is 3. Let's look and see who got that. What is 3? What is 3? What is 3? Smile 16. Smile 16. Got that. Awesome job. Great job. Wait, where'd you go? Smiles. Smiles. Awesome job. You're on the scoreboard with 500 points. Awesome. All right. First of all, Gym for Brazil. Look and see what you're saying. Who can tell me what Gym for Brazil is used for? What is that medication used for? What is it used to treat? Comment it right below. It's 8 p.m. over here, but good night, good morning. Yes, high cholesterol. Thank you so much. All right, Gym for Brazil is used to treat hypercholesterolemia, or high cholesterol in the blood. High cholesterol. One adverse effect is hepatotoxicity. Hepatotoxicity. All right. Hepato means liver. Toxicity means toxic. So one adverse effect is that it is toxic to the liver. All right. The medication does not affect glucose, and elevated triglyceride level is not an indication to hold the medication. Why? Because it's used to treat high cholesterol. So if they see a high elevated triglyceride level, that's not an indication to hold the medication. It's just not. An elevated BUN is unrelated to this medication. Remember, elevated BUN would let us know that there's some kidney issues going on, and this medication is hepatotoxic, not renal toxic. Okay. Yes, it's an elevated BUN is unrelated to this medication and would not be an indication that the medication should be held. All right. So the answer is 3 elevated liver function tests, because this medication is hepatotoxic, which means it is toxic to your liver. So in order, if a medication is toxic to your liver and your liver is being affected and damaged, one way for us to know that is for those liver function tests to be elevated. All right. So a good indicator of liver damage is elevated liver function tests. So that's definitely what you want. What the nurse saw. She saw those elevated liver function tests. Knowing that Gym for Brazil is used to treat high cholesterol, but can also cause liver toxicity. So if she sees those liver function tests, she knows that client is having having that specific adverse effect. Do not give that medication. That would only add to the hepatotoxicity. And contact the healthcare provider. Contact the primary healthcare provider for whatever to do next. Okay, so that one was what is 3 elevated liver function tests. Great job if you got that. Pink Rhea said I answered too fast. That's good. It's good. It's okay. All right. Let's do one more. One more. All right. One more. This is fundamentals for 500. All right. The nurse is instructing a client to perform a 2-point gait for crutch walking. The nurse should tell the client to perform which action? 1. Advance the right foot and then the left foot, followed by both crutches. 2. Advance both crutches forward, followed by the left foot and then the right foot. 3. Move the left foot and then the left crutch forward, followed by the right crutch, and then the right foot. And then 4 says, advance the right crutch and the left foot forward, followed by advancing the right foot and the left crutch forward. All right, a nurse is instructing a client to perform a 2-point gait for crutch walking. The nurse should tell the client to perform which action? 1, advance the right foot and the left foot, followed by both crutches. 2, advance, first of all, when you guys are reading crutch questions, do you guys like actually read through the answer choices and then pretend you have crutches and like be like, okay, is it this? Do y'all do that? Just asking. All right, so 1 is advance the right foot and then the left foot, followed by both crutches. So right foot, left foot, both crutches. 2 says advance both crutches forward, followed by the left foot and the right foot. Both crutches forward, left foot, right foot. 3 says move the left foot and the left crutch forward. So left foot, left crutch, and then right foot, right crutch. So left foot, left crutch, right foot, right crutch. I feel like I'm skiing. And then 4 says advance the right crutch and the left foot forward. So advance the right crutch and left foot, followed by advancing the right foot and the right crutch. Am I dugging? What is the answer? The answer is, what is 4? Advance the what? Oh, 2-point gait. Oh, I forgot. It's giving zombie for 3. 4 said advance the right crutch and the left foot forward, followed by advancing the right crutch and the left foot forward. This is the 2-point gait, apparently. All right, the 2-point gait is used when weight bearing is allowed on both feet. Only 2 points are in contact with the floor. Duh, Sam. Only 2 points are in contact with the floor. The 2-point gait closely resembles normal walking. It does? Okay, advance. Hold on. Because they're not going to lie to us in our face. Tell us it resembles normal walking when it resembled the Dougie. Okay, advance the right crutch. Hold on. Advance the right crutch and the left foot. Followed by, okay. Okay. It's whatever. I see their point. Okay, so 4. It says options 1 and 2 describe 3 points of contact. And then option 3 describes 4 points of contact. I would have got this question wrong and I feel some type of way because I'm Nurse Sam. Which is funny because that's why I would have got it wrong. I absolutely cannot. I can't. All right, so did I say who got that? Yeah, that was Smiles. Great job, Smiles 16, because baby. Wait, did I say that was you? No, I didn't say who it was yet. Let me see who it was. Or was it Smiles? No, it was not. It was... It was Kelly Jo. Hey, Kelly Jo. Yeah, it was Kelly Jo that got that one. Kelly with like 5 Y's. Joe, great job to you. All right, great job. Okay, and I read the thing. Okay, great. Let me go through your. No, that don't count. We need one more question. All right, let's do one more question, y'all. One more question. And I don't know if it's neuro. Oh, this one's neuro. Okay. Well, this is adult health for 200. So this happens to be a neuro question. Okay. All right. So adult health for 200. It says the nurse. Hey, boo, hey. All right. The nurse is evaluating the status of a client who had a craniotomy 3 days ago. Which assessment finding would indicate that the client is developing meningitis as a complication of surgery? 1. A negative Kernig sign. 2. Absence of nuchal rigidity. 3. A positive Brudzinski sign. Or 4. A Glasgow coma scale. What? A Glasgow coma scale score of 15. All right. A nurse is evaluating the status of a client who had a craniotomy 3 days ago. Which assessment finding would indicate that the client is developing meningitis as a complication of surgery? 1. A negative Kernig sign. 2. Absence of nuchal rigidity. 3. A positive Brudzinski sign. Or 4. A Glasgow coma scale score of 15. It is what is 3. And like all y'all got it. And I'm just so proud. I feel like a proud mama. All right. So who's the first person to get it? Because pretty much all y'all got it. And I'm so proud. Look at y'all. Ooh, Mo Love, you the first person to get 3, but you didn't say what is. Ooh. Future ER nurse said what is 3 first. So awesome job, future ER nurse. ER nurse, you're on the scoreboard with 200 points. All right, let's go ahead and read the rationale. So proud of all you guys that got 3. I'm gonna go ahead and shout y'all out because that was a great question and a lot of y'all got it. So, Mo Love, go, good for you. 2 for you, Glenn Coco. Future ER nurse, Lisa. 18, Purple Micah, Unknown Beauty, Baby Assad, Crave, Graduate Nurse Lori, Killa, Beautiful Av, Janice. I said that was a little hard, but y'all got it. I love when y'all said that was a little hard, but you got it though. You were successful in it. All right, so it says signs of meningeal irritation compatible with meningitis. All right, so I loved how the answer is 3. A positive Brudzinski sign. All right, the answer is what is 3? A positive Brudzinski sign. All right, so signs of meningeal irritation compatible with meningitis include nuchal rigidity. And first of all, I'm so proud of you guys for noticing that number 2 said absence of nuchal rigidity. If it would have said the presence of nuchal rigidity, that would have been something totally different. But I'm glad y'all just didn't see nuchal rigidity and were just like, oh, let me choose the answer. Y'all reading the whole part. I'm so proud of you. All right. Anyway, the presence of nuchal rigidity, a positive Brudzinski sign, and a positive Kernig sign. All right. Nuchal rigidity, that is characterized by a stiff neck and soreness. All right. That's especially noticeable when the neck is flexed. So you guys know that whenever they tell them to like look down and put your chin to your chest, whenever they have discomfort or soreness and stiffness right there, that is nuchal rigidity, neck stiffness. Okay. Kernig sign. All right. That's positive when the client feels pain, and y'all probably want to write this down. Pain and spasm of the hamstring muscles when the leg is fully flexed at the hip and knee. All right, so I don't know. When the leg is fully flexed at the hip and knee, when the client feels pain and spasm of the hamstring muscle, that is a positive Kernig sign. if I was doing, I promise, if I was doing a study kit, and I probably did do this when I was actually in nursing school, like I do my studying and I do my study kits based off of word association and sound association. That's how I do my studying. So if a word looks like or sounds like another word, I'm going to associate that word with whatever word that I think that looks like or sound like. Kernig sign, for some, the word Kernig looks like the word Kermit to me, like the frog, Kermit the frog. So to me, when I'm thinking about Kernig sign, I'm literally picturing a green Kermit frog flexing the knee and hip and saying, ow, question mark, yes, then it's a positive Kernig sign. No pain, negative Kernig sign. And I'm just picturing like me drawing a Kermit next to it to help remember. That's how I study, all right? Anyway, so that's Kernig sign, nuchal rigidity. Now, Brudzinski sign, that is positive when the client flexes the hips and knees in response to the nurse gently flexing the head and neck onto the chest. What? Okay. When the client flexes the hips and knees in response to the nurse gently flexing the head and neck onto the chest. Okay, so the nurse is gently flexing the head and neck onto the chest. So the nurse is doing that. And then it's positive when the client flexes the hips and knees in response to the nurse flexing the head and neck onto the chest. And then the Glasgow Coma Scale, that score 15, that's a perfect score, and that actually indicates that the client is awake, alert, with no neurological deficit. So we know that 4 is definitely not the answer, because 15 is a perfect score. So the answer, once again, is 3, a positive Brudzinski sign. All right? Awesome job. Awesome job. So yeah. Okay, guys. I went over, but I just wanted to somebody kept asking me for a neuro question. I want to just go ahead and make sure you guys had a neuro question. All right, so let's go ahead. That concludes our game. So let's go ahead and add up our scores. All right, so we have 2 people in first place. We have Baby Assad and Daddy's Girl for Life tied for 700 points. And then we have CP, Smiles, and Kelly Joe all with 500 points. Okay? So 1, 2, 3, 4, 5. All right, so let me know where you guys are at. All right, so we have Baby Assad and Daddy's Girl for Life. They're tied for first place with 700 points. And then we have tied for second place. We have like 3 different people. We have CP 108813, Smiles 16, and Kelly Joe all tied for second place with 500 points. So we are going to I'm trying to see how we, oh hey, great. I'm trying to see how we are going to break the tie. And we're not, because I don't have time for it. So all 5 of you won. Woo! Okay, never mind. Not Daddy's Girl for Life, because she purchased the Ultimate Bundle last year. But awesome! So you get the NCLEX Arcade workbook if you want. Whatever. All right, so awesome job and great job to all 5 of you guys. I'm just going to let all 5 of you guys win because, A, I'm super proud of all of you guys that came and had in practice with me. And honestly, it's just super hard to try to figure out who's going to win when all you guys did such a great job. So all y'all gonna win. As the owner of the company, I can do that because big purr. Oh, that's nice, baby Assad. That's nice. All right, so if you guys already have the Ultimate Nursing School bundle, um, if you so what's not included in the Ultimate Nursing School bundle is the critical care. Critical care is new, so if you don't have the critical care and you have the Ultimate bundle, let me know if you want that. So all 5 of you guys, I'm gonna let y'all know who you guys are again. Baby Assad, Daddy's Girl for Life, CP 108 813, Smiles 16, and Kelly Joe. DM me your name, your full name, first and last, and your email address. And if you want the Ultimate Nursing School bundle, Critical Care Nursing School Study Kit, T's study kit if you want. I don't know why you would want the T's when you were just studying for the NCLEX, but you know, whatever. NCLEX Arcade workbook. What's the other one? What is the other one? Oh, I think I said critical care already, but if I didn't, the critical care. Let me know if you guys, which study kit you guys would like. If you have already purchased all of those, then let me know. I'm going to send you study gummies or something like that. I don't know. But I'm definitely going to make sure that you guys are incentivized in some way. So all 5 of you guys, make sure you DM me your name, your email address, and whatever digital study kit that you want, starting with the Ultimate Study Bundle if you don't already have it. But if you do, get the next thing down. I don't know what else. Or you can donate it to somebody else. I've had some people that have from the past winners that decided to donate their bundles to somebody else that may be studying for the NCLEX and may need it. So you can do that as well if you want, but totally up to you. But you guys won fair and square. Thank you so much for playing, and thank you all for playing. This went over like it usually does because of whatever reason. We just have so much fun when we start studying. I'm telling you, studying like this is way, way better than like having your textbook open and like pretending to read the same page over and over again and really like having a panic attack at the end because you can't remember the past 3 sentences. This takes away like that pressure and just really allows you to really study and do what you need to do, but just have fun with it and make it just like light but also effective, right? So we do study sessions like these every Thursday, but they're usually only like an hour. It's usually from 7 to 8. But we were going to, I was actually thinking about doing another study session. We do study groups. They're just called tutoring sessions, but we're going to be like revamping that whole process so we can do study groups because these are fun, right? So like, you know, that's why we have these on Thursdays, and then for everyone that's like pre-nursing and that's trying to get into nursing school and take the T's, we have their version on Tuesdays. So this is super fun. Let me know. Well, I'll put a post up. I'm gonna ask for a post because we're gonna do. I'm gonna ask for your advice because we're gonna do a study group, like an actual like webinar. We're gonna basically have NCLEX Jeopardy, but we're also gonna go over some content and some chapters as well. But I want you guys to vote on the topics, especially because you guys were asking for a lot of neuro. Somebody said they were in maternity, so I want to pick like 2 or 3 topics, chapters, and then be able to like do like a 2 or 3 hour study session, review session, or whatever. So we'll be able to do that. I'm so glad you guys enjoyed this. Yay! Alright, so I'm gonna go ahead and download this. I'll go ahead and I'll upload this up on my channel. And then give me about like 30 minutes. Hey y'all, hey. Give me about 30 minutes, and I'm going to put these questions in the app. Make sure you have your app notifications on, because I'm going to send out a push notification letting you guys know that the questions are out, so you can play the rest of the questions. There's still 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. There's still 16 more questions that we did not do, so you guys will be able to do those in the app. Solo, alone, with people, whatever the case may be. I'll also throw some questions up in my stories. I could do this for hours and hours and hours. Yeah, I have fun too. All right, great job, guys. Thank you again. 5 winners. Do not forget to DM me your name, email address, and the actual prize that you want, the actual study kit that you want, okay? All right, I love you so much. All right, bye, y'all.